Today, we're diving into a condition that can turn something as basic as eating into a huge daily challenge. It's called eosinophilic esophagitis, or just EoE for short.
Just think about that for a second. For a whole lot of people, this isn't just some hypothetical question. It's their reality, day in and day out. This difficulty, this pain, is right at the heart of what it's like to live with EoE.
So, what is this condition that causes all this trouble? Let me tell you, it's not just a sensitive stomach or a bad case of heartburn. No, this is a specific chronic disease, and it has a very real biological cause. Let's break it down.
Now, that definition is packed with some powerful words. First, chronic. That tells you it's a long-term thing. Then you have allergic and inflammatory, which means your body's own immune system is basically overreacting. And all of this is going down in your esophagus. That's the tube that connects your mouth to your stomach. Here's a great way to think about it. You know how asthma is an allergic reaction in the lungs? Or how eczema shows up on the skin? Well, EoE is pretty much the same kind of deal, but the battleground here is the lining of your esophagus. It gets flooded with these specific white blood cells called eosinophils. And you know, how this condition shows up can be totally different depending on your age. For adults, the classic symptom is dysphagia. That's the medical term for having trouble swallowing. It can even lead to this terrifying experience where food literally gets stuck. But in kids, it can look a lot more subtle, like they're just a picky eater or they're flat out refusing food. Sometimes it even leads to what doctors call a failure to thrive, meaning they just aren't growing like they should be. Okay, so that raises a big question. Who is most likely to get EoE? Well, researchers have spotted some key patterns and risk factors that give us major clues. First off, there's a really big difference between men and women. The data shows a clear 3-to-1 ratio. So for every one woman with the condition, there are about 3 men. And while, yeah, you can be diagnosed at any age, there's a definite peak for adults. The most common time to get diagnosed is somewhere between 30 and 50 years old, and that's often after someone's been dealing with symptoms for years. So, the biggest takeaway here is the powerful link to what doctors call atopy, which is basically a genetic tendency to develop allergies. If you or your family have a history of things like food allergies, asthma, or eczema, that's a huge red flag for doctors when they're thinking about an EoE diagnosis. So that brings us to a key question. You know, with symptoms that can look a lot like acid reflux, how do doctors get to a concrete final diagnosis? Well, the process is actually very specific. It's really a multi-step journey. It all starts with the patient's story, what they're feeling. That story then leads to an endoscopy, where a specialist uses a tiny camera to look right inside the esophagus. Then, during that procedure, they take these teeny tiny tissue samples, called biopsies, and those get sent off to a lab to be looked at under a microscope. And this is the moment of truth. To officially confirm it's EoE, the pathologist has to actually count more than 15 of those specific inflammatory cells, the eosinophils, in one tiny little view under the microscope. It's that high number that really separates EoE from anything else. On top of that, the endoscopy itself can offer some big clues. Doctors might spot these telltale visual signs of inflammation, like rings or ridges along the esophagus, or even spots where it's starting to narrow, which are called strictures. Okay, so once the diagnosis is confirmed, what's the game plan? Thankfully, there's a really solid management strategy that doctors often call the 3 Ds. This whole framework gives a clear 3-part approach. You have to tackle the inflammation, you have to find the food triggers, and you have to deal with the physical damage from the disease. So let's start with that first D. The first D is drugs. The main goal here is pretty simple. Get that inflammation in the esophagus down. The first thing doctors usually try is a course of proton pump inhibitors, or PPIs. If that doesn't do the trick, they'll move on to topical corticosteroids. But here's the really important part. You swallow them. They're not inhaled like an asthma puffer because you want the medicine to directly coat the inside of the esophagus. The second D is diet. Because EoE is usually triggered by food allergens, a huge part of managing it is playing detective to figure out what those triggers are. A really common strategy is the 6-food elimination diet. You basically cut out the most common troublemakers like dairy, wheat, and eggs, and then one by one, you slowly bring them back to see which one causes the reaction. And that brings us to the third D, dilatation. Now, this one is more of a mechanical fix, and it's used when long-term inflammation has started to cause physical damage. It's really important to get this. This procedure doesn't treat the allergy itself. Instead, it deals with a physical problem caused by the disease. So when that long-term inflammation creates scar tissue, a stricture, and narrows the esophagus so much that food can't get through, a doctor can go in during an endoscopy and gently stretch that section to widen it back up.
So EoE is a chronic condition, right? That means managing it is a long-term journey. And understanding the potential bumps in the road is absolutely key for patients and their families.
And when you look at the long-term data, it's pretty eye-opening. More than half of all adult patients will eventually develop those strictures, that narrowing we were just talking about. And a similar number, 55%, will go through food impaction, which is that truly awful event where food gets completely stuck.
This is exactly why being proactive is so important. Of all the people who have food get stuck, a huge chunk of them, 38%, will need an emergency endoscopy just to get it removed. It really just shows you how serious this condition can be. So it's pretty clear that eosinophilic esophagitis is way more than just a digestive problem. It's this really fascinating, complex place where allergies and gastroenterology meet. And it leaves us with a much bigger question to think about. What can this unique condition teach us about the incredibly complicated dance between the food we eat, our immune system, and our health as a whole?